presenting our work on safety and efficacy of Botox injection in elderly patients with overactive bladder. My name is Habib. Myself and my two other co-authors in London Northwest University Healthcare NHS Trust. As we know, overactive bladder is common in elderly population. Detrusor Botox injection is a useful treatment for this condition if medical management fails or unable to tolerate. However, we the clinicians are much cautious to offer Botox injection in this age group due to the fear of complications and risk of retention. The majority of data in existing literature were from younger population and may not quite represent the outcomes in elderly age group. So, due to lack of enough data regarding safety and outcome of this treatment in elderly population, this study was done. It was a prospective study involving overactive bladder patients over 75 years of age. The procedures were performed with flexible cystoscope under local anesthetic in an outpatient clinic. Complications and outcomes were checked and follow-ups. Symptoms and responses to treatment were assessed with ICIQ-OAB and ICIQ Urinary Incontinence questionnaire before the treatment and at follow-up in 6 weeks. Data was analyzed using Microsoft Excel software, and PRT test was done to check statistical significance. In the results, as you can see, about 60% patients were female, and average age was more than 80 years. The majority had idiopathic Detrusor overactivity, which is more than 80%. The rest of them had neurogenic Detrusor overactivity. The average score of ICIQ overactive bladder before Botox injection was 10.32 plus minus 2.69, and after 6.7 plus minus 2.45. The improvement was statistically very significant with p-value less than 0.001, and the outcome of the other questionnaires were also similar with strongly significant improvement. Nearly 80% patients were happy with symptomatic improvements and continued further Botox injection. However, 37% patients were doing intermittent self-catheter, although only 18.5%, just less than 20%, commenced intermittent self-catheter after having Botox. So rest of them were doing intermittent self-catheter even before having the Botox injection. One patient had retention and another was readmitted with UTI. So in total, that makes about 7% in terms of complication. So regarding interpretation of the result, in this study, the average age group was more than 80, and overall success rates and symptomatic improvements were comparable with the standard literature involving the younger cohort. In terms of complications, what we can see, slightly higher incidence of doing intermittent self-catheter, which can be explained by some element of outflow obstruction and Detrusor weakness in this age group. One patient had complete retention, which also needs to be carefully discussed at consultation.